Healthcare in today's medicine is so complex that no one individual, no matter how intelligent or how well trained, can ever keep all of the information straight all of the time and never make an error. One of the characteristics of an ideal team is that safety is the responsibility of every single person on the team. We all agree with that. No one would disagree with that. But by the same time, in our practice, if it's not an area of my primary responsibility, then I assume that someone else on the team is handling it, and I don't worry about the safety of that aspect, even if I see something that I think may not be correct. In data collected by the Joint Commission in doing root cause analysis of sentinel events, they have found that when a wrong site surgery is about to happen, 80% of the time someone in the room recognizes it, but doesn't know how to stop the action in time. It is imperative that every member on the team, whatever the team setting, whether it's administration or surgery or ICU, every member on the team really needs to understand and be comfortable with assertion and critical language. Assertion is the ability for any member on the team to know that they can and are expected to speak up when they see a red flag, something that they don't think is right. Critical language is a technique that has been employed by other high reliability organizations to standardize communication. Critical language is represented by a word or a phrase that is chosen by a hospital or an organization, which draws attention to a particular situation. Organizations adopt critical language so that they have a tool that any team member can use that can immediately stop an action, even if it isn't part of their primary responsibility. One phrase that has been employed by other hospitals is, "I need some clarity." For example, if we're in the operating room and I as a nurse see something that makes me think that we are preparing the wrong site on this patient, I could say, "I need some clarity," and the team would recognize that they need to stop immediately while I take a little more time to develop what I saw that made me uncomfortable. One of the elements of adopting critical language is so that any team member that is suddenly uncomfortable with where we're going can use this predetermined phrase and stop the action immediately. Once the team has stopped, then we can take the time to develop what it was that that team member was uncomfortable with and make sure that what we're about to do is in the patient's best interest. When implementing a policy on critical language, we have to choose a word or a phrase that is not common in people's everyday conversation. And furthermore, team members need to be educated when and how to use that critical language. Team members need to recognize that when they use that critical language, the phrase, "I need some clarity," that it is tantamount to breaking the glass and pulling the lever on the fire alarm. It creates an action that cannot be taken back. If the whole team has been trained and is comfortable with the concepts of assertiveness and critical language, we create an enabling environment where any member of the team can prevent an action which they feel may cause harm to our patient.